New Zealand pharmacy legislation course. That is our topic for today. So, New Zealand pharmacy legislation course covers the legal, the ethical, and professional responsibility of anyone intending to practice as a pharmacist here in Ontario, New Zealand. So in this video, I would be explaining the eligibility criteria, the course outline as at when I did it, and also give you one or two tips on how to be successful at the very first attempt. So before I dive into all of that, please, my overseas trained pharmacist, if you are interested in this aspect of my life in New Zealand, encourage me to roll out more blogs around it by using that thumb up button and cheer me up in the comment section, because as a blogger, I only intend to roll out blogs in the area that people are interested in. So, what is the eligibility criteria for this course? So, for you to be eligible to enroll for this course, you would have started your documentation with Pharmacy Council of New Zealand. When I did it, you are expected to have written your KEPS exam, or what we call opera now. But now there's flexibility around it, either before or after your opera exam, but your documentation would have been approved to a status of at least New Zealand pharmacist graduate. And after that, I think the council would forward the names of people that are eligible to enroll for this course to Auckland University, and the organizer of this course, Soya Ram, which I think she is still the organizer, would reach out to you at the next time they would be organizing it. This course usually happen twice or once a year, depending on the student turnout, and she will reach out to you for the course. The course is remotely done, so you can do it while in New Zealand or while still overseas. So let's talk about the course outline. So this course is offered over 12 weeks, which is 3 months, and you will be covering 10 modules. That is what I did during my time. So the course is completely remotely offered, which means you can do it while you are still overseas. And there will be a trend or a platform the tutor will send to you to sign up. You will be meeting your mates, that is other students in that platform, once a week, and you would have your individual assignments and also collective assignments, which you will drop your answer in the trend, and you will learn from each other. The tutor would and make some corrections if there is need to. And yeah, that is all about the class and the interaction. And I think towards the end there will be question section where you guys will have visual Zoom that every student can call in and join, and you ask your questions and address things, just general interaction, yeah, to get things cleared out. So that was how it was during my own time. And I know some of you want to know the materials, the resources, how tedious the course is. If you are somebody into like law kind of things, if you read law materials and understand it easily, it might not really be a very big deal for you. But if you do not find law related things interesting, you might really struggle. And also meeting up with the weekly assignments, reading up. When I did it, I was working full time, wasn't very easy, but you will get there. I will give you tips on how to successfully passed through it at the very first presentation. What I did, that worked for me. So coming to the materials, the reference materials that your tutor would expose you to would be the Medicine Act, that is the New Zealand Medicine Act 1981. You would also be exposed to Medicine Regulation 1984, also your HDC, that is Health and Disability Consumer right here in New Zealand, and also pharmacy competency standards. You have to know all of them. These are the major four resources I can remember that I was exposed to. So these resources I would tell you, also MedSafe. Yeah, these resources I will tell you that you need it for your everyday practice here in New Zealand to ensure that all your ethical, legal, and responsibilities as pharmacy is well discharged during seeing your patients. So having said that, do people fail the course? Of course, it's an assessment, it's an exam. If you're not serious with it, I would say I would say yes, yeah, but yeah, I've only seen a couple of people that had to do it twice. Yeah, during my time, most of my friends that I knew, I think they progressed to internship, which means they passed. Yeah, so but you have to be committed, because my friends and I, the people I know then, they were quite committed. So coming to tips on how to go through it once, I would say one tip would be to take it seriously. Be in your class, like always attend your class, and if there are reasons why you cannot make it, please let your tutor know your struggles. For those of us that might be joining from overseas, if you are struggling with internet or something like that, please let your tutor know. And also always try to be very interactive in the classroom. If there are questions that you're met or the tutor throw, please try to interact. That would help you subconsciously to be picking up things, not really waiting for the assessment or for the exam time to read and go and write the exam. Interacting was a very great way that I learned on the go. Like as I interact, I pick up things. I get myself equipped with the laws and the whole thing. So that would be a very great way to also learn. And also, the very last tip I would be giving would be to be to ensure you are very good at typing fast, and as much as you can, if you can have like 2 screens or so on your exam day, so that you can, because it's an open exam. When I did it, you are allowed to open the reference materials, that is your Medicine Act 1981, Medicine Regulation 1984, but you should be familiar on how the schedules and the sections are laid out, so that you can easily find what you are looking for. So you have to be fast around using computer typing, and play around this and resources on how to find information very, very fast. For those of us that are yet to get internship space, that are looking for possible tips from me, I would be making another video to share tips on how to get internship space, but that would depend on the reaction I get from this, and also the number of people interested in internship site video. Alright guys, I would see you in my subsequent video. I forgot to introduce myself. I am Julia Chinello, your one and only out and about lady here in New Zealand. Anytime, any day. And I will see you guys in my subsequent video.